Imagine what addressing the fraud in Medicare would do.
If you could simply get Medicaid fraud alone, forget any other aspect of health care, if you could just get Medicaid fraud down to what would be the commercial standard for credit card fraud, which is 0.2% or less, that the amount you would save would finance all of the information technology in healthcare. And it's that big an amount of money that's lost annually because a paper-based bureaucratic system invites entrepreneurial crooks to see the opportunity to move faster and to take the money and run before they can ever get audited.
I would argue that Medicare is the most inefficient health insurance system out there, unless it's Medicaid.
The evidence I'm about to give you comes from 7 years of studies I conducted in 32 states. We consistently found several hundred doctors who were working obviously really hard because they were billing for 26 hours a day. These simple tests like that can save billions and billions of dollars if the states would put them in place.
A Justice Department strike force operating in Miami in 2007 prosecuted 74 cases charging 120 people with trying to bilk Medicare of $400 million.
My favorite example of this is by our good friend Alan Levine, who is now the health commissioner for Bobby Jindal, who earlier was the health commissioner for Jeb Bush. And when he was the health commissioner in Florida, he helped work with a state federal task force on HIV/AIDS transfusion. And on one day, they raided 17 facilities that were fraudulent HIV/AIDS facilities, 5 of which were pizza parlors.
Another example is if you're taking bipolar medications and you take more than 2, you probably will die. We found about 1,000 people in a state not far from here who were taking 3 medications.
A July report by the Government Accountability Office found that Medicare paid as much as $92 million since 2000 for equipment purportedly prescribed by doctors who were dead.
Who is permitting fraud and abuse? And I'll argue it's recipients, providers, states, and the federal government.
You find these things are rampant out there.
Merrill has actually raised the possibility that, and I'm going to let you decide this after you hear from our next speaker, Don Muse, but he's raised the possibility that we actually ought to have a contest. And the Center for Health Transformation should sponsor a contest between Medicare and Medicaid as to which is the more fraud-ridden. And we could invite people from across the country to file their particular stories.
Medicaid would win going away.